I love to take care of people and have since I was 10 years old. So I knew from a young age that this is what I wanted to do.
LewisGale Medical Center is a 506-bed hospital offering the highest levels of quality health care, including the latest medical technologies and specialized procedures, close to home for Southwest Virginia residents. While other large specialized hospitals nationwide offer similar services, it's LewisGale Medical Center's employees and physicians and their mission to personally connect with and care for patients, their families, and one another that make us unique. For these employees and physicians, healthcare isn't just a job, it's their passion and calling.
So I decided to become a physician when I was in high school. There were several reasons why I chose to do that. One of which was the tragic loss of my cousin, and he was killed in a car accident when I was 17 years old. I saw that as an opportunity to be able to help people in the future as well as to help my family grieve.
I had an uncle who passed away quite suddenly, and nobody really knew why. It was an uncle that was very dear to me, and that's what picked up my interest in medicine in the beginning.
Once you got into it and realized and saw that you were making a difference in actually helping save people's lives and truly helping them is what made me realize that this was for me.
Patients are our number one. That's why we're here, is to take care of them. But a lot of times the families become more of who we take care of because the patient may not be able to speak for themselves or, be able to communicate with us. A lot of times families need more of the personal connect and get to know us because they're the ones that are taking care of the patient after discharge.
Recently, I was caring for a patient who had stage 3 lung cancer. He had a massive infection all over his body. His body was essentially failing, and the family was not taking the news very well, and they wanted to go all the way, do everything we could to save him. And I cared for this patient for close to over a week, every shift I was on. And you build that rapport with the family and with the patient.
In dealing with patient families, we can be there for them in their time of need.
We had a patient who was a young man, about my age, in his 30s, who overdosed unintentionally, and we couldn't save him. And his mom, we had to obviously tell her that her son was no longer living, and I, after my shift, sat with her for about 3 hours because she was alone and her family members were all they were a few hours away and they weren't going to be here for a while. So I made a difference in her life in a different way than, say, caring for a patient.
I can't think of any day that I've ever worked as a nurse that I haven't gotten back more from my patients or my family members that I've taken care of during that time. Nurses truly do have an impact on families, on patients, on anybody they come across in any aspect of their job.
We have a great hospitalist team. We work together, we cover each other whenever somebody needs help. And if somebody has some questions, we are very friendly and we just work as a one team to help each other out.
Our nurses, we are a team. We lean on each other, we talk to each other, we support each other.
The environment is fantastic. It's such a collegial environment. The specialists are always willing to jump in and help. The nurses are just wonderful. The techs, the respiratory therapists, everybody understands that it's not just the attending, but everybody, has a role to play, and everybody's hands-on and everybody's willing to help.
I think the biggest thing that has contributed to LewisGale getting the Leapfrog A rating is the culture here at this hospital, is that people feel comfortable if they see something that could potentially be a patient safety issue. They're not afraid to speak up and to tell people, here's a concern that I have that could potentially be a patient issue. And having that culture here and making people feel comfortable to being able to speak up, I think is huge when you're talking about patient care and quality and patient safety.
Health grade A for Leapfrog has been a true team effort. Between the leadership, the bedside nurses, the director staff, coming together and knowing that we want our quality to be the highest that it can be and provide that care to our patients as a community has truly turned it around for us.
We do the very best to provide the quality care that everyone deserves.
LewisGale is a great place to work.
I saw how other staff members that currently work there were interacting with the people coming in the door. Even when I was trying to find where to go for an interview, it mattered to them whether they knew I was coming for an interview or not, and that was why I chose to be here.
Working at LewisGale Medical Center, for cardiovascular surgery has been fantastic. It's a very family-oriented environment. Everyone collaborates and works very well together. And I just see the patient care here, as far as the nursing staff and the operating room and the pre-admission, post-admission, the physical therapy. They really care about the patients here.
I think if you look for one thing that sets LewisGale apart is the personal touch that we have with our patients here.
I chose LewisGale to come work because my grandfather was a patient here on our rehab floor back in 1999. And they took such good care of him and took care of us as well that's what I wanted to be a part of.
So for me, I'm where I need to be and where I want to be, and that's being at LewisGale.